Hi guys, welcome to episode 44 of Tiny ADHD Superpower. Today's topic is on ADHD and motivation. Despite the many differences among children and adults with attention deficit disorder or ADHD or ADD, there is one similarity shared by virtually all of them. Although they have considerable chronic difficulty in getting organized, maybe getting started on many tasks, focusing their attention, sustaining their efforts, utilizing their short-term working memory, all of those diagnosed with ADHD tend to have at least a few specific activities or tasks for which they have no difficulty in exercising. These very same function in a normal or an extraordinary way. The inconsistency in motivation and performance is the most puzzling aspect of ADHD, says one doctor. It seemed like a child or adult with a disorder who can show strong motivation and focus very well for some tasks should be able to do the same for the other tasks that they recognize as important. It appears if this is a simple problem of lacking the willpower. If you can do this, why can't you do the same for that and that, blah, 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 blah. ADHD is not a matter of willpower, so fuck it. It's a problem with the dynamics of the chemistry of the brain. One patient said, I've got a sexual metaphor you can use to explain what it's like to have ADHD. This is funny. It's like having erectile dysfunction of the mind. If a task you're faced with something that turns you on, something that is really interesting for you, you are up and for it, and you can perform. But if the task, it's so funny, if the task is not something that's intrinsically interesting to you, it does not turn you on. And you can't get up for it and you can't perform. It doesn't matter how much you can tell yourself, I need to or ought to. It's just not a willpower kind of thing. The mystery of ADHD motivation solved. It's an article written by Dr. Thomas E. Brown, updated October 14, 2024. Some of the experts are below. Despite the many differences among children and adults with ADHD, there was no difficulty in accessing the very same function in a normal, extraordinary way that I talked about. The inconsistency in motivation, I also talked about. And so the willpower assumption is based on two fundamental misunderstandings of how the human brain works. The assumption ignores the complex and powerful role of unconscious emotions in the brain's processes of motivation. And it does not recognize the critical importance of working memory for prioritizing tasks moment by moment. And working memory is one of the testing criteria or the testing methods for ADHD for DSM-5. Many people think of emotions as involving only conscious feeling, limited sensation of sadness, anger, pleasure, worry, and so on, that a person is fully aware and generally able to identify. Neuroscience has shown that conscious feelings are only a tiny part of the vast range of emotions that operates within each person to motivate, execute executive functions. And that is very, very important for ADHDers. Sometimes, if a person thinks of a particular task as important, honestly believing that he wants to give it immediate attention and sustained effort, yet he cannot do it accordingly. He may continue to procrastinate, busy himself with work other than tasks that are urgent, something that he's interested in, or he may actively seek out distractions by getting in touch with friends, surfing the internet, getting high, going to sleep. Such contradiction makes sense only when we realize that emotions that guide our motivation often are not fully conscious or conflicting. We may be influenced by emotions that we do not know we have. And that is very important because self-realization for ADHD people It helps them with superpowers that they have, or what other people call a disorder. I call it superpower, as I mentioned again and again in my previous episodes. So many studies have demonstrated that treatment for stimulant medications, again, methylphenidate for me, improves the efficiency of neurocommunication. However, the increased release and slowed reloading is not under voluntary control. It occurs only for tasks in which the individual with ADHD has a strong interest in. The heightened interest may be because the activity has brought pleasure or other rewards to the ADHD person in the past or in the present. Or interest may be intensified and emotion as well because the person fears that something he or she anticipates being unpleasant is likely to occur very quickly if he or she does not attend to the task immediately. Whether because of anticipated pleasure or fear, the heightened interest generates increased release of dopamine instantly, and thus sustains it for as long as the individual intensifies interest persists, and that gives it motivation also. So the stimulants does help for me, but don't forget CBT also helps, and combining both of them can help you achieve your superpower over the years and continue to work on yourself. Thank you for watching. See you next time.